Okay. So Sydney.
I'm just being honest. That's terrible. Don't.
When somebody comes in and shows you what makes
There's
them
a
feel bad,
flare.
and you say, "That looks terrible."
I mean, you look much better now.
Well,
Yeah.
But I would have cried.
I was going to do that to you next. Now I know what I'm going to do.
Yeah, and I got it right. I know, I got it done before Christmas. I wore a mask the first 2 days at work, and everybody was like, "Oh, are you wearing a mask because you have the flu?" And I'm like, "No, I'm wearing a mask because I got my lip done. It looks horrible."
So she got her lips
this
done,
patchy.
and they're not how she wants them. And she was nice enough to share us a picture. I'm so glad that my staff said, "Yikes!" What'd you say?
She got botched. She did.
I mean, it's not. So but I mean,
I wanted more volume in my top lip because I felt like you couldn't see my top lip when I smiled, and now it points out like a duck almost from the side.
so this and what you told me. I mean, so they took something that bothered you, and it got more.
Yes, I wanted more volume. I wanted you to be able to see my top lip when I smiled, and now I feel like my side profile is horrible. Like, it sticks out way over my bottom lip, and then I was told I didn't need any in my bottom lip because my top lip was, or my bottom lip was supposed to be 1/3 the size of my top lip, but now my top lip is so big because they put so much in it, and now it's
My
sticking
highlights
out.
aren't red; it's just the lighting.
Yeah.
It's so much like
What do you
color.
think?
Yeah, you can.
Okay.
So this is what she's talking about, and what you can feel. I'm gonna show you with my pencil. So what was your experience like, though? I mean, don't tell us where you went, but you wanted to go somewhere. What helped you choose where you went? What made you decide to go where you went?
The price was really good, so that's why I went. Honestly, I probably should have done a little bit better research, but actually when the doctor got me in there, I felt comfortable with him doing it because he spent so long talking to me about it. However, I don't know, there were maybe some red flags, I guess I should have added. Like, he didn't really listen to what I wanted because I felt like I should have had a little bit in my top and in my bottom, and I think he convinced me not to. And then when they were talking about the size of the needles, I mean, I'm a nurse and I know that you can't put a 20 gauge in my lip, and so maybe that was another sign that maybe I wasn't in the right place. But I'm not happy. I've not been happy. I've actually try to hide it, and it's really hard to hide your lips, except that I'm a nurse, so I can wear a mask at work, but that's
So you just wear it walking around the halls?
Yes, and everybody makes fun of me. But they think I'm wearing it because it's the flu season, and I'm not. I'm wearing it because my lip looks horrible.
And it is, so I'm going to show them, like, it really is, you can see the shadow when she talks, and this is where the filler is.
It does make my speech funny.
I know.
And I can feel the lumps in my lips.
So it's really like it's right here, and I feel some there, and then I can see it here. And so it's like they put it above, and what she hates about her profile is the way her upper lip, really shoots out beyond her bottom lip. And then it's like it's in these little, this is a natural thing in your lip. I think you said, this is a natural thing in your lip where it goes up a little. So you really don't put a pile here and a pile here because that accentuates that worse. So it really does look, it does kind of look like that.
It does look very much like a duck. Mm-hmm. My brother says I look very pointed. Yeah, thanks, Chase.
How old's your brother?
We're 18 months apart. He's about to be 31. He's like, when is the point going to go away? Like, everybody keeps asking me when the swelling is going to go down. I'm like, I don't think it's swollen.
So how long has it been?
It's been almost 3 weeks.
And what would keep you from going back to where you were and saying, I mean, I understand.
I don't know, because I'm in the medical profession. I just feel bad. I don't know. Because he was so sweet, but it's not what I wanted, and I'm not happy. And I don't feel like it's not something that he does, like, every day. Like, maybe he shouldn't do it. But, I don't know, he said he had a lot of experience, but he's been doing this for 8 years. That's what he told me. But prior to retiring, he retired and then has been doing this 8 years. But he was nice. I guess I'm too nice. I don't know.
But plus, when you're in the medical profession, you feel like, it's like, I won't send food. Well, I will send food back at a restaurant. Don't let me lie to you. But I won't eat it when it comes back.
Yeah, exactly.
I feel like they're going to spit in it. I mean, not that we would spit in your Juvederm, but you know, there's that sense, like, if
Yeah.
we did something and you were uncomfortable and you didn't come back, I would personally be insulted. Like,
Yeah.
I want you to tell
Yeah.
me. Like, that's what
Yeah.
that's the only way you know,
You get better at it. I
yeah,
guess.
or that you form the relationship with people that
Mm-hmm.
you want where they know they can come to you. Mm-hmm. And
I just didn't feel like that was the type of place you go back and they fix it, if that makes sense. I wouldn't feel comfortable. I would feel comfortable coming back here, but maybe not there. I don't know, because I felt bad. Like,
And how's it affected you? I mean, like, just in your daily life. And it's embarrassing.
I wake
know,
up
'cause
and I look in the mirror every morning. I'm like, oh shit, what did I do to my face? Like, this doesn't look like me. And I wanted just more. I just wanted it to be fuller, like just a little bit of
And
volume.
this was the first time you'd ever done anything? Mm-hmm. So what made you come to me? I'm glad you're here.
So a couple of the girls at work had mentioned you, and then I saw like some of your videos online, and I don't know, like when you were doing it and your technique, I was like, that's what it's supposed to like how you massage the lip. Like, he didn't do any of that, and I'm like, oh, that's probably should have gone to.
Well, yours is kind of in clumps, so
Yeah.
it's here. And when you talk, so these little muscles are real fine, and they're kind of like this. So when you put a big clump of volume in it, like is right here, when she tries to talk, it probably feels funny too.
It does. I feel like I have a lisp, and I don't.
You do kind of sound like that. But that'll go away very quickly.
Mm-hmm.
And we appreciate, and I know y'all do. Y'all can give her some hearts. Because it is very hard to share something like that.
Mm-hmm.
But it helps people not go do the same thing. I mean, because I think there's nothing more. I mean, lips, fillers, it's almost like you can mess that up more than you can mess up. So, you know, at least
Yeah.
you have something. And it is, like, it's for us, for women, it's like, I mean, when you have a zit and you're getting so many hearts and you don't want to get up. Like,
Yeah.
you wonder if it's still there.
Like
in the
3
mirror.
days after I got it done, I immediately started researching ways I could undo it, and I was like, "There's got to be a way." And honestly, I googled the Hyalase or whatever that you do to inject to remove it, and your name was the first name that popped up in Birmingham, Alabama. So I was like, "Okay, this is just meant to be."
Well, who knew that? I do my own website. I must have pushed wrong.
I don't know. It came up. So
Well, I'm going to dissolve right here, and it's kind of like this whole part of her lip probably doesn't even feel like her lip because it's just really thick and heavy. So really within a day, I mean, you're going to start, you're going to start to feel better, and it's going to be better, and it's going to go away. But it's like if you have a zit, you don't want to, it is embarrassing, but at least people know you didn't make it. When you have something like this, it's just a whole nother level.
yeah,
And there's so many people that wouldn't come here or wouldn't go anywhere and would suffer with it. And there's just no, somebody told me this morning we had some people from Nebraska. And, they were talking about how quiet and top secret it is and how many of their friends, just people don't want to tell you what they're doing. But we do this so that people don't go have something done that they don't need to get done. But you want to take that? But we can definitely help. So that picture's awful. That must have been horrible.
yes, it was.
But this will go away.
Yeah.
And you can stop wearing the mask unless you want to.
I've kind of gotten used to it now. I feel like if I don't wear it, then they'll know something's up.
And you were pretty sure it was Juvederm, or do you know?
No, I know for 100% it was Juvederm Ultra Plus.
I bet that hurt because it's kind of a lot of volume. Do you want to
It was the worst pain I've ever
feel that? Sydney, you feel it.
Y'all's
Feel
reactions.
it. It's like,
It's hard.
So after I do this,
so it shouldn't feel like that. You've never
Okay.
had it. It shouldn't feel thick like that. Like
Okay.
it should feel natural, like part of your lip. And that's how you want it to be.
when I first walked in, she was like, "No, that's not what it's supposed to look like," and I was like, "Okay, I know."
Good.
She was like, "No, that's not what it's supposed to look like."
So that, Sydney has it in her lips.
Yeah,
You feel-
that's what
you
I
can
wanted
feel
to
her
say. Like,
lips.
I love your lips. Yeah, I love your lips.
That's how I keep her here. I never get her
Yes.
lips quite big enough.
Yeah.
No, but that's perfect. Like, that's
Bad, I walk around with
I have
pollen.
like a thing in the back.
Come
We're just
here.
ready to inject. Yeah,
Yeah.
that's what I have in mind.
no. I love your lips. Your lips look amazing. Like, that's what I was going for.
They'll be like this.
Okay.
They will.
She brought our ring light. Isn't that neat? It shows, it kind of takes the shadows. It makes
Yes.
the
You'll
light
see.
that's fun.
It's kind of like the case on
That
my
mommy
phone.
hurts.
Just like that, same concept.
Anyway, this burns a little bit. This is what will dissolve it, but it'll dissolve it very quickly.
Okay.
I've been there. I've had to dissolve it. I'm glad you came, and I'm glad we can dissolve it. But it shouldn't feel like that.
Okay.
And this one has a lot in her lip. Probably. Don't you?
looks
You have at
perfect.
least two. Do you have one or
I've got
two?
one. I've got one. We have one and a half.
But you've probably got it in your
one.
bottom and your top.
But you
lip.
just have to disperse it. So I think,
Yeah.
judging from
yeah, it looks better when you do both. Like I had all
Yes.
the big lips, but it looked way better when she put it in.
and when somebody tells you, oh, it's a third this, a third that, all those things are true in theory. But it's an art, like and
Yeah.
I think probably whatever the tunneling thing was is what got you. This hurts though. I mean, no joke about it. So I'm gonna feel it. And try to. I know.
Oh shit.
I know. You okay?
Sorry.
You okay?
Mhm.
You can show me if you don't want to show the world
Okay.
the pain and suffering. I mean, I know it hurts.
Oh shit.
I think if she doesn't mind, I'm sure they'd rather.
Oh.
This problem, the reason it's going to hurt so much is there's a lot of volume in it.
Mhm.
So we're in the point. This is for your brother.
Oh.
And then
I
I
know.
felt bad because afterwards I'm like, does it really look that bad? And he's like, oh no. I mean, I would. I'm like, oh god. No,
Well, I mean, you've got so much volume in your lip, like the just adding the volume, like it feels like a rope. It shouldn't feel that way.
It's like rubbery.
I know. So adding more volume in order to dissolve it even. And we may have to dissolve a little more, but honestly, by the end of it's just like big glumps of it. Was it really just one syringe?
It looks like Vera Abrams when she did hers.
Yes.
Oh, sweet Jesus.
Is that somebody we know?
Everybody knows Vera
Teen
Abrams.
She's Teen Mom.
Teen Mom, Vera
I'm
Abrams.
just making sure it wasn't someone.
No.
I don't know, but I'm like, you can't say that.
No.
I don't know people like that. I'm so tired of
No.
everybody talking about. Then I finally thought I knew somebody, and it turned out it was a singer instead of a politics person.
She's a Teen Mom.
What is a teen mom? Like
Yeah,
dance
the
moms?
show, like me and Grant watch it together. Teen
I don't
Mom.
know.
Ask
I know
him.
dance moms.
It's like the same thing, but just
But they have kids when
younger
they're 16.
women that have children.
Wow. Y'all don't want to know what I watched this morning. But also, I watched Bewitched, and then I'm taping Green Acres.
South Park.
I love South Park. But I like those Three's Company. It's a new station I found, Logo.
Oh, okay.
Have you heard of it?
Mm-mm.
I was like, I'll take that and that.
Yeah. I've got good comebacks on that show.
That's when things were simple.
So people
Like,
want to know how soon is this going to dissolve and what's kind of the process of how this
it's
works.
going to dissolve. Like I had some dissolved in my lower lid before I did my own, and literally by the end of the day, because I couldn't see over it, I could see better. So I mean, this is going to dissolve quickly. The problem and the reason I can't make it not hurt is because you have so much volume in your lip, and having to add volume makes that even worse. And I have to be able to feel it. Your nails look good though. There's a win.
There's a win.
Somehow I have a photo shoot tomorrow that I didn't know about. So guess where I'm going?
To get your nails done.
Hmm? My son has a cast that had to get cut off because it was too tight.
What do you do?
Yeah, I don't know. Now he's cast free. He doesn't care. It's probably gonna be destroyed in a minute, but he's happy. I bet it hurt a lot when they put it in too, because they put it all in one.
It went like up. Like that's how I felt. It was.
Just one. You got stuck one time.
No, it was like multiple sticks, but it was going up. Tunneling is what it was called. Tunneling.
So there are all kinds of ways to learn injectables. I trained in Atlanta with some people, and then I've master trained with Allergan. You know, and that you have to do a lot of it. I mean, we do that last year. We did more fillers than anybody, at least in Alabama. I mean, you have to do a lot of it, but you also have to see it. And I compare it to hair color, but you know, if you ever just sat there and you're like, my hair's red, and somebody's like, no. I mean, with dark hair and highlights, it's harder. But it's that same feeling of trying to make, it's an art. It's like trying to make somebody see something. Like these walls, like they kept telling me it was mermaid green, and I said, no, it's not. But it was the color temperature of the light.
Yeah.
It's like you can either see something or you can't.
Yeah.
I mean, and you can't learn to see it, even if you can learn to inject safely. The problem with this is it may not have been safe because you had so much volume you can break down skin from pressure. You know, I mean, you're not going to, you
Yeah.
didn't, but I mean, it's good to get rid of it, and I'm glad that you're, because it,
So will I have to have this done again, or?
maybe, I hope not.
Okay.
I hope it's going to settle down and you'll be happy with it and have a little bit more of a lip. Some of it is in the right spot, but some of it's above the right spot.
Okay.
So if I can dissolve, but that's kind of hard. I mean, you
Yeah.
know, we'll have to see how that.
Okay.
But I want to see you back, and
Okay.
hopefully you're going to be better.
Okay.
You know, it's funny how you always know, and then you think back on all the ways you knew,
Mhm.
isn't it?
Mhm. Definitely should have.
I've been through
Definitely
it.
should.
I know. I really do. But when I had my lipo and it wasn't right, and I tried to tell him it wasn't even, I told aerobic, so I decided it was just me. And then I was teaching, and somebody, you know, really looks at you if you're up there. Somebody came up to me and said, "What happened to your legs? I think maybe you have a mass or something on one side." And I was like, "Oh my God, it's not just me."
Yeah,
Because
it's not
I mean,
just you. Yeah.
then he looked at me and was like, "You look great."
Yeah.
And I was like, "I'll never be that person that says that to
Yeah.
anyone."
Because I ask people at work and they're like, "No, I think it looks great," but then I walk in my house and my brother's like, "Your lip looks pointed," and I'm like, "There's the truth. There's the person."
The
that's
problem is your lip has a natural curvature and it goes straight down, and so they accented, like this eye's higher, this eye's lower.
Mhm.
I'm not trying to kick you
No,
while you're
it's
down,
okay. It's
but
alright.
it's good. You
Yeah.
just have to note everybody's different. You just
Mhm.
have to notice it.
Mhm.
So for somebody to put more on this side and skip that because of how it made it look worse.
Yeah.
You can see it.
It
You know? Do you know what I'm talking about?
Yeah.
But see how it goes up like that?
Mhm. Yeah.
It
it's
did
like
that
it's like
anyway,
a
but that's
divot.
pretty. That's like a little decoration in
Mhm.
you. That doesn't need to be ablated. That just needs to be softened. But you have to pay attention to what you can't put a big blob right here and then skip that and put a blob there because it makes it.
Yeah.
But I like it, and you'll see it'll be really pretty
Okay.
when we're done. But you'll just go home and ice, and then we'll see you back.
Okay.
I'll see you whenever.
Okay.